Okay, good morning, everyone, to all my colleagues in Carroll County. Tuesday, April 28th, rapidly approaching May, and we're about 6 weeks into the pandemic. I usually start out with giving statistics this morning, but I'm not going to do that. We've got the health department on, Ed Singer, the head of our health department, on this morning. So when we get to him, we'll have him do all that. As we always do, we're going to start out this morning with the pledge to the flag, and then we're also going to observe a moment of silence and remembering to keep all those in your thoughts and prayers of those folks that are on the front line of this pandemic. I actually had someone that I know very well pass away from this COVID, so it's starting to hit home. And I think we're going to soon be hard pressed to not know someone that has not been affected by this. So I would ask at this point we all stand for the pledge, and then we'll observe that moment of silence. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay, thank you all very much. We'll go into priority Carol here. I'll turn it over to my first Vice President, Ed Rothstein.
Good morning, and a few things just up front. One, I had a really good event on Sunday with the COAD South Carroll that we put together, serving around 200 folks, between 175 and 200 folks in two pop-up pantries, one at the Calvary United Methodist Church in Gamber or Finksburg, and then the other at St. Joseph's in Eldersburg. Really appreciate Commissioner Weaver participating as well. Had some really strong volunteers out there. We really look forward to seeing what we're going to be able to accomplish in the weeks to come. Again, kudos to our economic development team. I'm getting some good responses regarding the Small Business Fund, and folks looking for the next and the final go-around of the Small Business Fund, which should come out midweek this week with the instructions. I will be having a Zoom meeting, virtual meeting, with the Sykesville Main Street. I had it a couple weeks ago, and we're doing it basically every 2-3 weeks to share how the small businesses on our main streets are doing, and then also what are some of their requirements and needs. Lastly, I just want to share the importance, as I see it, to adhere to our governor's executive orders. We may not agree with all of his executive orders and direction, but the way I believe we're going to get through this is if we're all in it together. And as I always say, one team, one fight. So, as leaders, I appreciate all of us participating in sharing what our governor is saying and the executive orders for us to get through this pandemic as soon as possible. And with that, I'll stop there. Thanks.
Second Vice President, Commissioner Weaver. I might not have been unmuted. Second Vice President, Commissioner Weaver.
There we go. Okay. Microphone wouldn't come on. I had a chance to attend Mr. Rothstein's pop-up food kitchen Sunday. He got me soaking wet, but let me tell you, it was an amazing event, and the number of people coming through, the number of volunteers, and the way it's organized. Ed, I do have to say, your organizers for this have done a phenomenal job, and everybody was on the same page, had it all put together, very, very simple way it operated. So I give those people a lot of credit for putting it together. And I do want to say I've had a lot of feedback from small businesses. Our loan program has been fantastic. Just a little help in this, but that help is, I think, greatly appreciated. So that's about all I have.
District 3, Commissioner Frazier.
Well, good morning. I would echo the remarks so far about the small business loans that we're putting out there. I've heard nothing but positive things about it. And what I've heard the most positive is that the applications are done quickly and the checks come out quickly. Unlike the other programs that are out there, I won't go into any, but it takes a while to get the money going. People have already got money in their hands. Why, like Commissioner Weaver said, it's not a ton of money, but anything and everything helps. And I think it's a tremendous job that the county has done. I want to make one note about masks that people are wearing as I'm out and about. If the mask is below your nose, it's not doing you a lot of good, and the people around you a lot of good. I'm out yesterday and I see people with masks in the stores, and the mask comes across the ear and goes below the nose. And I realized that most of those people were wearing glasses. And I realized when you wear glasses and the mask fogs up the glasses, I understand that. But if the mask is below the nose, you're not helping yourself or you're not helping people around you. So just, I don't know the answer. As you can see, I wear glasses, but I wear the mask and take the glasses off. So I walk in a lot of things now. So it just makes a little, but it's just something you have to deal with. I know it's inconvenience, but I think it will help everyone out. Everyone follows the rules. And if you have the mask on, put it across your nose and mouth as well. That's all I have. Thank you.
So being the scuba diver that I am, little trade secret, wash your glasses with toothpaste. And then that'll help with the fogging. And that's always been a trade secret with scuba divers. And if all else fails, before we went in the water, we spit on our goggles. So spit on your glasses. How's that? All right, District 4, Commissioner Boucher.
Good morning, gentlemen. Well, I'm hoping after this pandemic passes, Commissioner Frazier will keep wearing a mask. I'd like to thank the leadership to Commissioner Rothstein and all the volunteers that stepped up for that food pantry. Since day one, that has been a very important issue for me to ensure that no citizen in this county goes hungry. And I'm very grateful for everyone who's been involved in that networking system that's helping feed the people who are in a bad situation. Also, like to give a special thanks to Ed Singer and Celine Steckel and their staffs. Their departments have been under tremendous stress over the last month and a half. So keep up the good job. We're behind you 100%, and we realize that the hard work and sacrifice is going noticed by everyone in this administration. Also, I'd like to thank Jeff Daggett and the Park and Rec staff for keeping parks open. This weekend, I went up to Crimgold Park, did some walking, did some fishing. These recreational activities are very helpful, not only physically for us, but also mentally to get out. And they say sunshine's good for you. So try to get out and do some walking as much as possible and stay healthy. Special thanks to all those people involved.
I heard because of the COVID-19 thing, the fish are staying away from you, Eric.
Okay, just a couple things for me. My wife and I had the opportunity to volunteer at one of Carroll County Public Schools food distribution sites last week. And if you want a humbling experience, I encourage you to assist with one of those. Seeing the young kids in the car all say thank you is an incredible humbling experience. Speaking of the food pantries, the one in Silver Run is going strong at Bud's at Silver Run. I talked with both of those folks on Saturday, and they are also receiving a huge amount of donations, both monetarily and with supplies. So I applaud the folks in the southern part of the county, but want to also say that the northern part of the county is doing very well as well. So that's just a sure sign that all the food pantries are doing wonderful. So I encourage folks around the county to participate in whatever manner you can. I also echo Commissioner Rothstein's statement. I know that there has been, and I try not to look at social media. You all know how I feel about that. You want to be brought down, go on social media. That'll bring you right down. But I think it's incredibly important that everyone continue to go by the governor, who I think has been doing an amazing job. And we're not going to get through this unless we continue to abide by those things in which his staff and he has put into place. I truly do not want to be doing this again in October. I really don't. So if we don't do it right this time, we're going to be right back where we are again. And I don't think we can do it physically, mentally, or fiscally as well. So I hope everyone continues to roll along there and do what we can. And before you know it, I think we'll be back in some sort of normalcy. I do know I received a phone call this morning that Carroll Hospital Center had a very rough night last night. They had an uptick in patients. They've got quite a few on vents now. So the hospitalization over there has increased. And I also do know that Ed and his group, Singer, will be looking at the Shipley Arena again today for now another reason, and that is to perhaps put a testing facility there, which it would be very good to do as they can drive through that building. So we'll hear more on that as we move along. That's all I have for Priority Carroll. Our County Administrator, Roberta Wyndham, do you have anything this morning for Priority Carroll?
No, sir. Thank you.
Okay, with that, then we're going to get, we got Ed Singer on here, and we are going to, get a report from Ed. Ed, I know you've got the latest statistics, so we're going to start with that. And I also wanted to, you and I had a conversation the other evening. Many people are asking about what in the world does contact tracing mean? So I think it's good that you're on here this morning and you can answer some of those questions. So let's start out with the stats this morning, Ed, and on behalf of all of us around the county. And you and I talk, I don't know how many times a week, but quite a few, but all of us truly appreciate the work that you and your staff are doing as well. You're doing an amazing job. So Ed, I'm going to turn it over to you.
Thanks, Commissioner, and thank you to the entire board for the support that we've gotten during this pandemic. It's not been an easy situation for any of us, for the entire community. So starting out with the cases, we have a total of 388 cases in Carroll County. 170 of those are community-associated cases and 5 fatalities within the community. We have 243 facility-associated cases, and there are a total of 47 deaths in facilities. Our number of deaths in our community seems to be relatively low, so our percentage of fatalities in the assisted living facilities is relatively high compared to other jurisdictions. But our number of community deaths is just that much lower, and that's why the percentage of assisted living or nursing home related deaths is relatively high. One of the things I wanted to say is there was an editorial in the Carroll County Times this weekend, and I was going to send a response yesterday, but I didn't send it out because I knew the governor's office was getting ready to make an announcement on sharing facility data, and we haven't gotten direct guidance on exactly what that's going to look like yet, but it's been a bit frustrating for us because early on in this pandemic, we had shared information specifically about cases and whatnot in a couple of facilities where we had outbreaks in Carroll County. And we were doing that through the governor's office and through the JIC and had MEMA's blessing and everything. And then eventually MDH's attorneys came back and told us that we weren't allowed to be sharing that kind of information. So we've been kind of in that holding pattern, and the press has been complaining that things aren't transparent and people want to know about this. And while from a standpoint of what's going on in facilities having an impact on the general public, that's relatively minimal. There is a large push to wanting to know about this information, and the governor put out guidance yesterday that he wants MDH to release the facility related numbers. So we're going to have to find out exactly what that's going to look like. But I would imagine once MDH comes up with a protocol with how they're going to share that, we're going to share the data locally because our data is more current and up to date because we're able to directly track those things. And they're waiting for death certificates and other things that we don't necessarily wait for. So once we get guidance on how that's going to be shared, I would imagine that we're going to make that available on our website. We've actually been sharing more information on our website than I think other counties have been sharing because we thought it was important to at least separate out the community-based data and the facility-based data. So that's all I have on that piece. And before I get into the whole thing on contact tracing, I did want to mention, it was nice for Commissioner Frazier to mention about the masks and why this is important. There's actually scientific studies out there that show that if somebody has COVID-19 and they're neither them or the person that they're in close contact with is wearing a mask, that the transmission rate's about 90%. And while, it's going to be uncomfortable for us to wear masks and whatnot, the transmission rate for people who are in close contact drops to less than 1.5% if people are wearing face coverings. So that's going to be critically important as we move forward with things to help keep from making each other sick. So before I move into contact tracing, do you have any questions about those two things? And then I'll go ahead and give my presentation on contact tracing.
Ed, do we have enough kits or testing to see who has the virus and who doesn't?
So that was going to be a little bit of what I was going to mention towards the end of my presentation today. But where we stand right now, the only people that we're testing, and we're working in conjunction with Carroll Hospital Center, who's running the testing tent. We're essentially having our call center refer there right now. Is we're only testing people who have underlying health conditions. So that's the protocol that's set up, and that's what's recommended by CDC right now. But that's going to have to change as we reopen things, and I'll talk about how that fits in with our with the whole contact tracing and everything as we move along. And that's one of the reasons that we want to look at this ag center as a potential facility for expanded testing, because if we're not testing people who are potentially sick, then we have to assume they're sick, and people wind up in quarantine longer. So it's all part of this puzzle that fits together, and I'm going to talk about that in my whole contact tracing presentation.
Hey, Ed, before you jump into that as well, one, definite appreciation for you and the leadership you got on your team and what you're doing. The coordination with the big box stores, if you can touch on that, because I know there was a bit of challenge in getting everybody on board. I did go into the Walmart in Eldersburg yesterday, and I think the wake-up call made a difference. There's definitely things on the floor, and people seem to be more spread out. But if you can, share with us, is it working with the guidance and the coordination that you're doing?
So thanks, Commissioner. And I want to say we got a fairly early jump on this, and we sent our environmental health staff out to give people just the guidance when CDC first put out guidance on social distancing within these stores that were open as being essential. And a week later, we were finding that not everybody was following the guidance. So I coordinated with Commissioner Wentz and some other folks and put together a letter that we sent out to the retailers saying, look, we're going to have it's kind of funny because it coincided with the governor issuing the executive order that gave the local health officers the authority to order businesses closed if they didn't comply with the social distancing requirements. So we put information in there, and we coordinated with the sheriff's department, with the county, and with a lot of the retailers. So we got this information out to them. We went back out and did re-inspections, and essentially almost all the businesses in the county were doing what we wanted them to do. We ran into the one that you referenced down in Eldersburg, and we actually had very good conversations with their corporate headquarters, because a lot of these large box stores have corporate guides that the store is supposed to be following. You don't always get as much support down at the local level if you've got a road manager or somebody who just doesn't feel like dealing with it. And the support of the corporates in some of these large box stores has been very helpful in helping us gain compliance. I know there's been a lot of controversy statewide about health departments potentially shutting down businesses and things of that nature, and some businesses have been shut down. Fortunately, here in Carroll County, I think we've been proactive enough on this, and we've had enough coordination with our elected officials stepping in and talking to the corporates and whatnot, that we've been able to fix any problems that we've had in any of our facilities at this point in time. While we've issued one essentially order for immediate compliance, we've not had to issue a closure order to anybody at this point. And I was concerned, that we might have to do that, because the last thing we want is a citizen going out who needs to get groceries or whatnot, going to the store and then finding out it's closed because they haven't been complying with the social distancing requirements. So I think that's all going very well. I'm really happy with where we are. It seems like most of the stores are complying. We struggle a little bit here and there with some stores, but then we have to, we talk to them, we talk to the corporate, and we get them to fix things. And we've had complaints about other businesses as well. We've had concerns about Random House and the number of people there and things of that nature. We've gone out and looked. They're doing everything they're supposed to be doing. So, it's great to see the businesses stepping up and doing the things that they have to do to make sure that their workers and the community are safe. All right. Anything else before I move on to the contact tracing piece? Okay. Really, I asked the commissioners, I talked to Commissioner Wance, and I asked to come on and kind of talk about this in open session, because I think it's important. And we're going to be doing social media messaging and issuing a press release and everything else related to this. But I think it's really important that everybody understands what contact tracing is all about and why we're doing it. And it's important because it's part of the governor's plan to reopen Maryland and to keep Maryland open. And I know this is going to seem like a lot of government intrusion on people's lives, but if people are not honest with us and don't follow the guidance, we can end up with another spike. And Commissioner Wance referred to in October. Well, as we open things up, it could happen almost immediately if people are spreading the disease. So if we don't follow the guidance in what we're doing with contact tracing, we could wind up with a spike and returning to quarantine. And none of us want to do that. I know I've heard Commissioner Boucher talk about the impact this is having on mental health, and we're working with our partners and the Partnership for a Healthier Carroll County to get messaging out there about resources and whatnot for people who are, while we've been in this quarantine, the impact that this is having on people's mental health. So it's important that we're doing this contact tracing to prevent people from getting sick from each other. We're getting this up and running now, so the system's in place when the governor gives the go-ahead for people to begin reopening. So we have to have a system in place, and we want to have the system working before we get back to getting people back out in the community. Contact tracing is not something that's new to health departments. Our communicable disease staff do this for diseases like sexually transmitted infections, tuberculosis, and measles. It involves talking to people who are infected with the disease to find out who they've been in contact with and who might be at higher risk of contracting the disease. It's different depending on the disease and how it's spread. For instance, with sexually transmitted infections, only people who are partners will be at risk. So that's a very limited group of people. Measles, for instance, is highly contagious. So we have to inform the public who were in the same location hours after the infected person was there so that we prevent the spread of measles. COVID-19 is kind of in between the two of these. We believe it spreads mainly through close contact with a person who's infected. So people who are close contacts of an initial infected person are at risk of having COVID-19. So what is a close contact? And that's kind of one of the keys here. And right now, with everybody kind of being in self-quarantine, there aren't a lot of people aren't going to have necessarily a lot of close contacts. So close contacts are defined as living in the same household or household-like setting with a person who's positive for COVID-19 or is symptomatic. Face-to-face contact with a person who's positive for COVID-19 for 15 minutes or more. Now, there's been varying guidance on this depending on the setting, and CDC said some places anywhere from 2 to 3 minutes up to 30 minutes. So right now we're using 15 with our contact tracing, and this may change to stay consistent with what everybody's doing statewide, but 15 minutes in close proximity within 6 feet of another individual. So obviously, if you're in the same household, you're gonna be passing and whatnot, and automatically makes it like that. But just your passing by somebody in Lowe's or Home Depot is not necessarily going to put you in close contact. But if you do have sustained interaction with somebody within a 6 foot distance for more than 15 minutes, then that would make you a close contact. Having been seated in an aircraft with a person within 2 seats in any direction is considered to be a close contact. Direct contact with body fluids for a person who is positive for COVID-19 and being in the same room where medical procedure is being done on someone who is positive for COVID-19 or having contact with a lab specimen is considered close contact. So part of the challenge with COVID-19 is it can spread before someone has had symptoms or know they're infected. So it's kind of important when we're talking about potentially quarantine people that they follow the quarantine guidance, because, you know, even if they feel well, the first day or two that they're shedding, they might not have any symptoms, and they could wind up spreading it around to a lot of people. So that's another reason why this contact tracing is so important. When somebody tests positive for COVID-19, the health department is going to be in touch with them. We're going to interview them and learn who they've been in close contact with. And the people who they've been in close contact with are at higher risk of becoming sick with COVID-19. It's extremely important for people to answer all the questions honestly and completely. And all I said, I know people are going to feel like this is government intrusion. It's really important that we be able to keep our community open and that we don't spread this disease all around. So we need people to be honest and upfront. Our staff are going to call those close contacts and give them resources to help them protect themselves and their families and the community. Current guidelines is that we cannot share the name of the person who's infected, even if they give us permission. But if a person's infected, they can certainly tell people that they've been in contact with. So that's kind of what we're suggesting to people at this point in time. I'm trying to push the state on the state level to at least let us ask permission from the person who's infected to be able to tell them who it is, because we're going to get a lot higher level of compliance with folks if I'm able to say, hey, Steve Wentz was in close contact with you, and he's got COVID, and he's given me permission to tell you that he's the one who had COVID. If we just tell them that you've been in close contact with somebody, people are going to wonder who that is and why they can't know who that is. And while I could tell Steve Wentz, tell those people you've been in close contact with that you have COVID, he might or he might not. The other problem that we ran into earlier on in this whole thing is people falsely reporting that they had COVID-19, announcing it kind of in the middle of a box store or something and causing undue panic. So I think it's important if I can influence the folks at the leadership level at the Department of Health to let us at least share the name of the person. If the person gives us permission, I think that would be helpful. I don't think I'm going to get any traction on asking to share the name if the person doesn't want it shared, but most people are willing, because this is not a disease that has any stigma really associated with it. Most people, I think, would be willing to let us say, hey, yeah, Steve Wentz had it and he was in touch with you and you and you, and that's why we're calling you to talk about quarantine. So I think that, we've got in place what we have at this point in time, but I want to try to see if we can push for a little bit of change to that at the state level. So close contacts who have been in contact with somebody who's infected will be asked to quarantine for 14 days. This means limiting contact with others, even in your own household. It means monitoring yourself for symptoms. And if you develop symptoms, you'll go into isolation similar to the person who tested positive and follow the guidance for being released from there. And we'll be in touch with people along the way in this process. The person who's infected will follow similar rules and isolate until they are no longer contagious. And our staff will be following up with everyone from quarantine and isolation to release them from quarantine or isolation. So it's going to be challenging for people to quarantine and isolate until we have treatment and vaccine. It's the best way for us to slow the spread of this disease and to prevent the health system from being overwhelmed. And contact tracing is essentially going to save people's lives. So contact tracing is one of the 4 components of Governor Larry Hogan's plan to reopen Maryland safely. The 3 others are testing, medical surge, and personal protective equipment. And the health department's working on all 4 of these aspects with many of our community partners. So if you test positive or might be at risk of COVID-19, you'll hear from the health department. It's important to be honest. Please trust us. We've been doing this for years. And while, people are reluctant to trust the government, there's no reason for us, no benefit for us to put people in quarantine unnecessarily. This is the best way to slow the spread of infection and keep the community safe. When we reach the thresholds the governor has discussed, we all need to do our part to keep Maryland open. So I want to talk about this testing piece too, because Commissioner Weaver had brought that up. And right now, we're really only testing people that have underlying health conditions. And if we only tested those people, that means anybody who was sick that had potentially exposed somebody who might not actually test positive for COVID, we'd be putting people in quarantine for 14 days, probably unnecessarily. So if we wind up ramping up testing and we're able to test somebody and get results back in 2 or 3 days, we might only have to quarantine somebody for 2 or 3 days as opposed to 14 days, which is going to help with them getting back to work or getting back out in the community in whatever capacity. So this testing piece is just as important as the contact tracing piece. And as we meet out at the Ag Center today to look at expanding capacity, the protocols for who gets tested and who doesn't get tested are going to have to change. I mean, right now, obviously, the priority are the nursing facilities because that's where we were having the large outbreaks and the most illness and the most deaths, but and also people with underlying health conditions are at most risk. But as governor's been really trying to get us more testing equipment and more laboratory capacity, we're going to need to expand to anybody that's symptomatic, and potentially we'll be looking at anybody who has a doctor's order for a test, regardless of anything else. That may be the screening criteria at some point in time as far as who we will be testing. So that's kind of where I see this all going. And I'd be glad to take any questions any of the commissioners have for me at this point.
Ed, I appreciate all that information, and there's a lot of information that you shared. 2 things that to me are very important. One is your assessment on where Commissioner Weaver was going, the coordination that you have with the hospital as far as testing and as far as sharing the information. But then 2, if testing is not available for the contact tracing, your issue you mentioned was putting people through your assessment into quarantine, potentially unnecessarily, especially if folks are lying about, hey, I'm associated or I've been near somebody with COVID-19 to get out of the situation, if that makes sense. I mean, I know it's kind of like the chicken and the egg, but I see it as a critical issue if the testing is not available in conjunction or in partnership with this contact tracing. Can you give your thoughts on that?
Well, that's why I think, and we've been pushing for more testing resources. While Carroll Hospital Center has been a great partner in getting the testing done for people in the community who medically need it right now, this testing becomes more necessary from an economic standpoint as far as I'm concerned. And I think it needs to be a priority. And the governor has emphasized it as part of the 4 things that need to be done. So if we don't have testing available, it's going to make this contact tracing very difficult for people to want to comply with, and it's going to make it very difficult for us to implement. So I think those 2 things have to go hand in hand, especially right now. Contact tracing is relatively easy because the only people that most of us are having contact with, I mean, I'm here at the health department, so I have contact with some of my staff on a regular basis, but most people who are in quarantine at home are essentially only having contact with people who are in their hospital and their household members. So the big concern is, and the other need for testing is the fact that this disease can spread from people who haven't had symptoms and could potentially be positive. So there's a lot of things that go into that, but I think, as I said, the whole contact tracing right now is relatively simple because it's mainly household members who are those close contacts. But as we get into this, I think that you've got to have testing to go hand in hand with contact tracing, or this isn't going to work well.
Thanks.
And I got a question for you. Kind of for contact tracing, but more anyway. Again, workers come into your house, HVAC, plumbing, electrical, whatever it happens to be, and they come into the house, you let them in, they fix whatever it is, they're there for a prolonged period of time. What are the protocols you should follow when they're in the house? And what is the chances if they have the COVID-19 and don't know it at the time and they're in there of you actually getting it?
Well, we'd recommend the same thing here as we would for public places. And actually, I had an air conditioning mechanic come out to my house over the weekend, and the guy came out. He wore a mask, and I wore a mask while I was there. So, the best we can do is to try, like we do in stores, to prevent the spread in public places. If you've got somebody coming in that's not part of your normal household, both folks wearing face coverings is going to do a lot to prevent the potential spread of COVID-19. And I think really that's the best thing we can do at this point when you need those necessary services.
And I appreciate your leadership on this. And the contact tracing seems like a good tool for you to utilize. It sounds labor intensive though. And how are you on your human resources? And do you need help? And brief us on that. What do you need from us?
So Roberta and I have actually had some conversations about this. For the moment, while all the health department services are shut down, I'm pulling everybody in who's available that's a health department staff member, and we're standing this up just with our internal staff. But as I see this progressing, we're going to have to use some of the federal grant money that we've been giving to hire contact tracers. And what we'll do, the way I see this working is, we're either going to work with the county to hire through your personnel system, grant contingent type personnel to help us with contact tracing, and we'll rotate some of those people in as we rotate people out into their own jobs. It's estimated that for contact tracing, you need 25 people for every 100,000 population. So, we're looking at probably somewhere in the neighborhood of 35 or 40 people that we'll need to have doing contact tracing. And some of our core staff are going to be involved in this for the long haul. And this could wind up going on until there's a vaccine. We may be looking at doing this for 6 to 12 months. But, maybe as we get downward in the curve, the number of people will be less. But this is going to be a moving target as far as how many people we need to have doing this. But it's kind of given us a good opportunity with health department services essentially being shut down, be able to use our own staff and kind of figure this out. And then we can figure out what the staffing pattern and the skill level of the people need to look like. And we can work with your personnel staff and whatnot to figure out how we're going to staff this. The state system is just so slow in hiring people. By the time I bring people on here, it'd be 3 or 4 months down the road with the state hiring system. So maybe they'll do something to loosen that up. But I'm looking at going a different direction. They've already had a conversation with Roberta about getting you guys to support us in hiring contractual folks that would be essentially grant contingent to help us do this contact tracing. The other option we have is we could also put it out on a consultant contract, but that kind of gets to be a little sketchy, and we really don't have good control over the consultants as we would if we've got somebody that's an employee, even if they're a contractual employee, as to setting the hours and whatnot that we need them there. This is going to the other thing that I didn't mention about contact tracing, it's very important that we do this immediately when we find out about it, because if we wait a couple of days, it doesn't help any, because we've already let somebody who's potentially should be quarantined get out into the community and spread the disease. So the timeliness of once somebody tests positive, of doing that contact tracing that day or at least within a day, there's studies out there that show if you don't do it that day or within a day of finding out the person's positive, you might as well not do it. So the timeliness of this is also important. The state's also supporting this with a platform, and there's a call center out of Chicago that they're going to be using. There's There's a IT platform called Salesforce that we're going to be using as a database. I'm really not thrilled about the idea of having people make cold calls to people in Carroll County from Chicago. First of all, I don't think they're going to trust them. I don't think they're going to want to talk to them. And I think we need to staff this here locally and work with our local citizens from a Carroll County standpoint, because while the state's made this resource available to us, and if we have a huge spike, we might have to resort to it. I really want to avoid trying to use the call center that they have that's been set up with the I think it's University of Chicago's got an organization that they've contracted with.
Hey, Ed, I guess my original question on testing, I look as we get into this, a company say has 25 employees and they're going to have to open up here. They almost have to have their employees tested. You take the ones that are positive, they isolate for a number of days, retest. The ones who carry the immunity marker or whatever, and the ones testing negative could probably be employed at that point or be working. But do we have enough testing to do that, to get things reopened in the county?
Well, I can tell you if it was today, the answer would be no. But I'm being told that that within the next couple of weeks, the supplies that the governor got in from Korea are going to be made available to local health departments and local jurisdictions to increase testing, and that they have contracts with additional laboratories. Because the one concern that I had when he talked about getting all these testing kits was, I was like, well, that's great, we got all these testing kits, but who's going to run the tests? And laboratory capacity is another issue. And the state has told me that they have several laboratories that are ready to contract to begin running additional tests. So I'm hopeful that within the next week or two, and it's possible that if we have a good discussion today, that we could wind up standing up a testing facility in a week or two out at the Ag Center that will be ready to take this on.
Can we go to self-testing, set up our own lab somewhere to take care of the county personnel? Is that possible?
And COVID testing, I think would be a bridge too far. I don't think we've got, I mean, if there's a company out there in the private sector that wants to set up testing, there's a demand for it right now. And I'm sure you could make a profit on running COVID testing. But I know we as a local health department don't have the capacity to do that. The state lab is the only resource from a state standpoint that has testing capacity. The rest we're relying on the private sector to do this testing.
Hey, Ed, you mentioned it earlier about behavioral health and drugs, alcohol, suicide, domestics. Besides the anecdotal comments and opinions that it may be out there, or even the news media that may highlight a specific suicide or issue, by the numbers, are you seeing an increase in behavioral health reported cases, drugs, alcohol, suicides? And we already heard from the sheriff about domestics, that there have not been an increase, or if it is, it's very slight at this point. Can you talk about that for a minute?
Statistically, we had a discussion on the state call this morning, and I don't have. I can ask Sue Doyle, who's our local behavioral health authority, if we have some local data. But statewide, I think the numbers are actually pretty level or lower than what we're normally seeing. However, the people who are showing up for treatment with behavioral health, mental health type issues are showing up with much more complex and complicated issues. So I'll ask Sue. I didn't pull that together this morning for this presentation, but I'll ask Sue to pull together any data that we might have over the last month or two to help put it all in perspective for you.
Yeah, I appreciate it, because again, from my perspective, we got to share as much of the facts as possible and leave the opinions and the anecdotal comments and pontification to folks in the media doing their thing. But the numbers matter. And although we can expect or suspect, increases, But if the numbers aren't there, then we shouldn't be saying that they're there. And, I just want to be very careful about that, especially as we're going through this. But thanks.
Thank you, Commissioner.
I think a good indication of the mental health issue might be to see what type of mental health prescriptions are being prescribed throughout the county, whether there's an uptick in that. Is there any way to get into that data, potential data, to see if there is an increase in mental health pharmaceuticals being prescribed?
I'd have to look into that. There's a lot of restrictions on how we can use CRISP data and whatnot. I'll look into whether or not we can pull the prescriptions for behavioral health type prescriptions being prescribed. We do get data on doctors that are potentially overprescribing and not following the protocols, but getting the overall data for how much is being prescribed throughout the county, I'm not sure if that's something we can obtain or not, but I can ask for it.
Thank you very much.
All right, anything else for Ed? The only thing I have, Ed, those bullet points that you gave, the 15 minutes within 6 feet and, all those things, 2 feet within an aircraft and all that. Can you provide those bullet points for us?
Absolutely. That's all going to be going. It's probably already out on social media. My public information team's doing a great job. Maggie and a couple of others that we pulled into that are doing a great job of coordinating everything with the state and getting that information out there. I'm sure we've already got it out there on social media and information linked with our website, but we can put it in an email and send it over to you.
Yeah, some sort of a press release format or something like Maggie did on social media would be good, so we can have those and throw those out on our site as well. Anything else for Ed? Anybody?
Ed, I just want to make sure you stay healthy. If you get a chance, go out for a walk and enjoy the outdoors. You got a tremendously stressful job, and all of us on this board are very, very grateful for your leadership in this epidemic. So thank you.
Thank you. And I think our plan is, Commissioner Wentz, is we were planning to do a press release. I'm not sure whether it was today or in the next day or two, related to this contact tracing and everything else that goes into this. And we were looking to do that jointly with you all. So that should be something you should be looking forward to, that I know Chris Weinbrenner and Maggie will be coordinating on.
Excellent, as always. Okay. Thank you very much, Ed.
Have a good day.
Yep, you too. Keep up the good work. Thank you. All right, we're going to move on through our agenda items here. Next up is the FY21 Youth and Family Engagement Grant acceptance, and that's through our Department of Citizen Services. So I know Celine is here. I believe I saw Corey on here as well, and I believe Debbie Standiford's here. But Celine, I'll turn it over to you.
Okay, thank you. Good morning, Commissioners. I am joined here today with Corey Hardinger-Wilt, our Program Manager for the Local Management Board, and also Debbie Standiford with the Department of Management and Budget. Everybody knows she's our Grants Manager. I just wanted to say thank you again for all the compliments that everyone had given us earlier, just moving into this. And so I appreciate that. Today, though, we are here seeking approval for submission for the FY21 Youth and Family Engagement application and acceptance of the award. The Youth and Family Engagement Program is part of a larger statewide behavioral health diversion initiative of the Maryland Department of Juvenile Services. This program is currently being administered by the Youth Services Bureau, who provides behavioral health case management services to youth, in addition to providing linking their families to community services to keep youth in their homes and divert them from adjudication within the juvenile justice system. The state funding for this program is $80,000 with no required county match. The local management board provides the monitoring and fiscal oversight for this program. At this point, I am going to turn it over to Corey so that she can provide you with some of the detail and the success that this program has seen in the past 2+ years that it's been operating.
Hi, good morning. So the basic premise behind the Youth and Family Engagement Program is really addressing the whole family. So a lot of times when youth have issues, when you really start to dig in, some of their behavioral issues may be related to factors within their families, such as poverty, housing instability, things like that. So this program really looks at the whole family. So it works to connect the kid to resources and also the family. There are links to housing, employment services, mental health, behavioral health, all of those things, with the premise that if you address the whole family's issues, the children will do better. This program to date has served 53 youth and families. And I think the biggest highlight is really, so a year out after a youth is served in the program, they reach back out to that youth in 1 year, and 100% of these kids have not had additional DJS involvement, meaning they have not had any juvenile issues, any juvenile contact with DJS, which is really important. The goal for the program was 70%, and right now they are maintaining 100% of youth not being involved in any additional juvenile charges. And during this time of COVID, the program went, like many providers, has gone to telehealth services. So they're still connecting with these kids and their families, still providing them services. They've worked with the school system to make sure that the kids are all still engaging in school. They've provided technology to the families. And as of last week, the program is again accepting new referrals. So for a while, there was a hold on any new kids getting into the program, but at this point, they're able to offer this program to kids who may need it during this time. Any questions? Anything else?
I'd like to state that this is a tremendous program and one of the best investments we can make. And I'm sure the Sheriff's Department is grateful, because in the long run, we're helping prevent these juvenile offenders from growing into adult criminals. And I can testify firsthand how important juvenile programs are. So I'm 100% behind this. Thank you for all your work.
Sure. Yeah, it's really a prevention model. And I think there's been a shift in DJS in addressing prevention and trying to reach kids sooner rather than try to fix them after they're deep into the system or they're out of their home, trying to prevent that removal from their home and prevent them from going further into the system, and really looking at the whole family and what the whole family needs as opposed to just the kids.
Y'all do wonderful.
I move that the Board of Commissioners approve the submission of the FY21 Youth and Family Engagement application and accept the award.
Second.
All right, any other questions for these folks? All those in favor? Unanimous. Thank you all very much.
Thank you. Appreciate your time. Thank you so much.
All right. Next, we have to buy a water heater, or maybe we already did, but we got to make it official. So I know Justin is on here to explain the project and what happened. And I believe, is Maureen on?
I'm here.
Yep, there's Maureen. So we'll start with you, Maureen, as we usually do, and then we'll get into the explanation with Justin.
Okay, great. As you can see on your executive summary, we had to make an emergency purchase of a 600-gallon PVI turbo-powered gas-fired water tank for the Carroll County Detention Center. This purchase was made through Combustion Services, the local Maryland representative for PVI Industries, and the Aquaplex duplex tank. The cost to cover all the material and labor, including disposal of the old tank, supplying and installing the new water tank, and all the materials for installation and testing of the new unit, was $49,313. This is within the budget, and no additional funds will be needed.
Morning, Commissioners. So what happened was we had a 30-year-old hot water tank over at the detention center that decided to put a leak on us. So we have a temporary repair on it now to get us through. We needed to make a quick judgment call in getting this ordered, so we wouldn't have a catastrophe down the road if that water heater did go out on us. The water heater that's over there now, Commissioners, is 30 plus years old. We're replacing like for like. This particular water heater is a heater that's designed for high volume, high usage, quick rebound on hot water, as to support the detention center and all their faucets over there. Like Maureen said, this is replacing like for like. Figure a day and a half, 2-day job, Commissioner, to get this done. The water heater did have a 10 to 15 day lead time. This went out April 21st. So I believe first week in May, we should be able to get this scheduled to get installed. I'm going to leave it up for any questions that you may have.
Is this new hot water heater more energy efficient than the last?
Now, this is replacing like for like, Commissioner. This particular water heater is designed for high output, high hot water to get that demand out there to the cell blocks rather quickly. This is like for like, and the reason why we went like for like, Commissioners, is it leaves that downtime to a minimum because we're replacing like for like. So if we're going to go in there and redesign the system, it's going to be more downtime with the units not having hot water, and we can't afford that in this certain situation.
Justin, did this go out to bid?
It did not. This came across my desk Monday, I believe it was, and PVI, this Complete Combustion Services, they're a sales rep for PVI. So any other local contractor that's going to get this water heater has to go through this PVI Combustion Services. So what we kind of did was we cut out the middleman and went right to the rep and had the rep sell it to us and install it for us. And you got to be certified to install these type of water heaters.
So because it's like for like, this is the only one that was available, and that's why it did not go out for bid, correct?
That's correct. And we have, Commissioners, we have worked with Combustion Services in the past. They worked on this water heater for us a number of times in the past few years, so they are very familiar with this product. They know the detention center. They've worked in there before. So this is going to be the cleanest, the easiest in and out job to get this system back up and running.
All right, any other questions for Justin? If not, I'm going to make the motion that we approve the emergency purchase in the amount of $49,313 to Combustion Services for the new water heater tank at the detention center.
Second.
Any other questions for Maureen or Justin? All those in favor? Unanimous. Thank you both very much. Good luck with that project, Justin.
Thank you, Commissioners. Have a great day.
Okay, next on our agenda is airport grant application and acceptance of award. And we've got a ton of folks on about this one. Jeff, or you, Castonguay, you're on. I'm going to let you start this, and then you can introduce who you want in this whole mix as we get through it. Jeff, good morning.
Good morning. Thank you very much, Commissioners. Today in front of you, we're receiving the first of some of the grants that are coming available to all parties from the federal government with regards to the CARES Act. And so I don't steal any thunder from Mark and Eric, I will pass this to Mark to give a little description of the grant and what is available to what's coming available to the county. So Mark, take it away.
Okay, through the 2020 CARES Act, they've allocated $10 billion and made it available to airports across the country. General aviation airports have been allocated $100 million of that money, and the FAA has notified the county that $69,000 has been made available to be put under grant for Carroll County Regional Airport. The grant money has been provided to help support airports at this time of economic disruption. Funds coming directly from the U.S. Treasury and can be used for any purpose for which airport revenues can normally be used.
That's pretty good news. I would have liked to see a little 69,000, but that's pretty good news. I'm sure you've got plenty of uses for that 69,000, right, Mark?
Absolutely, sir. Lots of ideas.
Okay, Eric, anything out there?
Sorry, Commissioner, I didn't hear what you asked me.
You have anything to add on that grant money? I mean, that's a pretty good explanation. I don't know if you had any additional or not.
Yeah, no, nothing real additional. Mark laid it out pretty well. There was a set amount that we were given, and so that 69,000 is what we were apportioned for our airport.
What's the ETA on that funding, Deb? Are we going to get that pretty quickly, or what? How's that award working?
Good morning, commissioners. I imagine it's a reimbursement like the other airport grants, so they'll spend and then ask for reimbursement. But I would imagine it's available immediately, like all the CARES Act money.
I move that the Board of Commissioners approve the submittal of the 2020 CARES Act grant application and approve acceptance of the grant for Carroll County Regional Airport.
Second.
Okay, any other questions for Eric, Mark, Deb, Jeff, etc.? If not, all those in favor? And that's unanimous. Thank you all very much. Good luck, Mark. Spend wisely out there. We appreciate it. Thank you.
Thank you, Commissioner.
Okay, we're going to move right along and keep our public works folks on the line here. I kind of asked this to be put on the agenda for today. It's been about a week or so since we have put the landfill back in some sort of normalcy out there. And I thought it was a good period of time now to get an update on how those things in which our staff put in place are working, and see how we're doing out there. So going to start with you, I guess, Jeff, on this one as well.
No problems at all. Always happy to sit back and get the ball on the tee. So not that my swing will hit the ball, but at least I'll take a shot at it. So Commissioner Sa, thank you very much. Appreciate your time on this. And Commissioner, thank you for Wayne for bringing this up. We do want to, let me start by thanking the entire board for your consideration, your assistance with the landfill. As Cliff is about to talk to you about and provide you these updates, we're able to make some drastic changes at the landfill that have been put in place, a little tweaking here and there as people have been coming through. But as Cliff will report, we've seen a lot of these measures in place that are there that are going to protect our citizens, further protect our citizens, and protect our staff. We are trying to do everything we possibly can to keep our staff safe, keep the citizens safe. In your efforts, even being closed that 1 week, I know it was difficult. We made a lot of strides. So I'm going to pass this over to Cliff to kind of give the update and report. And Eric, do you have anything else to add to this?
That was perfect intro.
Okay, good morning, commissioners, and everyone who's listening or watching in. And first off, I do want to echo Jeff's sentiment and state our appreciation for the difficult decision that was made to temporarily suspend the resident access to the facility. It was an opportunity that we needed, especially with the extra traffic coming in, to really evaluate how to better protect residents and the employees in this time. It was also a good test of our systems that we have in place, not only at the scale house, but throughout the facility, and give us an opportunity to, as Jeff said, make some bigger changes and do some tweaking. Before I get into it, though, I really want to express tremendous gratitude to the teams that have helped us out along this process. Facilities, Justin and his people, IT, Greg and Bobby and their team, roads, especially the sign shop. We've been keeping them in business a little bit. The accounting department, Mike and Leah, just for starters, and I'll get to our team in a moment. But each of those teams has had a great impact on pushing some things along. As mentioned, the biggest thing we needed to do really was to honor the executive order and try to make sure maintain public safety and employee safety at the landfill, both at the scale house, but also at the public use areas. At the scale house itself, the biggest improvements really were within employee PPE, plexiglass at the windows, keeping the transaction numbers, the handling of the materials to a minimum. Both of those have been done. We have a driver's license scanner now at the inbound scale. That was moved over from the outbound. Far better to have it there. That's a follow-up to the initial screening that we were doing when we reopened to ensure that we were only accepting customers from within the county. We've implemented tear weights on as many vehicles as are participating at the moment with the haulers to expedite turnaround time for them. The IT department has replaced 2 aging computers at the workstations, the inbound and outbound scale stations. They were slated for replacement later in the year, but it became very, very obvious with the high traffic volumes over the last month or two that they began to fail ahead of time. So IT jumped in and helped us replace those. There's a server replacement that's pending, and we're also pursuing some other options with regard to outside payment centers and things of that sort that are a little more longer term, but will also benefit us not only now, but as we go forward. At the homeowner use areas, again, to improve separation, that'd be the yard waste and the regular waste areas. To improve separation, we have traffic controls where necessary and where applicable. We don't want to put them in areas where they could be run over, but it's been very helpful, especially at the waste drop-off. We have a significant amount of signage now across the facility. We can't have an employee watching everything every moment, but the signage helps educate and direct the customers in each of those areas. It's been very effective. The employee guidance where we can. We've also had a sheriff's deputy during the closure period and also the initial transition time into the partial reopening. And the sheriff's deputy presence has been invaluable. I know that they've had to stretch their schedules as well to help us out, but I think it's really made a difference having that individual out there, especially during busy times. From a customer perspective, and we did get a chance, and I've had a chance to speak with many of the residents coming in, as well as the private sector customers. Everyone has been generally positive and understanding. And I think that's from everything that we've been putting out there, but also what's going on regionally and nationally. I think the level of understanding is really increasing. So we've heard a tremendous amount of support and positive reaction to what we've been putting in place. And again, the procedures are intended to protect everyone, including our customers, not just our employees, but including our customers. And I think that message, has been received. With regard to our team, especially before we did the partial closure, it was a very, very stressful environment. But throughout that time, everyone at the facility, particularly those that are front-facing to the customers, have all been positive, particularly the Waymaster Group. It's been a very, very stressful situation. That period of time got us to put all these improvements in place. It gave an opportunity, again, for especially coming out of the employees to identify opportunities going forward. Gave everyone time to adjust to the changes, not only us, but the customers. And again, particularly, I'll touch it again, the Waymaster Group. It's been service with a smile. As stressful as it's been, they have been nothing short of stellar in dealing with the customers and making sure that we're representing the county in the best way we can. So I'm sure I've missed some people in that thank you list, but everybody's been very, very helpful. We even had during the closure period, we had a sewer line break coming out of the scale house. So it happened at a good time, not at a bad time. But facilities guys and outside plumbers jumped in and helped with that. It could have been really bad had that happened when we were dealing with 600 or 700 customers a day or more. Fortunately, for once, something happened at a good time rather than at an inopportune time. But again, thank you to the board for their support during this time and support that will be coming going forward as we make the improvements that we need to make.
Well, Mr. Engel, for someone who's relatively new to your position, you've done exceedingly well, and I like your leadership and your personality in dealing with this. Thank you very much.
Thank you for the kind words. It's my pleasure.
Okay, any other questions for Cliff for Eric on the landfill.
I have a question. I'm sorry, Steve, go ahead.
Go ahead,
No.
Dennis.
Okay. I do have a question. I want to know how well the message got out, I guess, to the people using the landfill. In other words, were there a lot of turnaways or any at all about people coming at the wrong times? Did people come from out of county, or did the message get out quickly enough so that really wasn't a problem at all?
I wouldn't call it a problem. When we were temporarily closed there for that week, there were a number of residents that came in. Again, we have a message board at 140 and the entrance to the facility. And we have another message board internally at the facility as well. We did have some that came in, noticed that we were serious about what we were doing. Some of that was the sheriff's presence, and they turned around and left. But it didn't happen often. So I think that word did get out during that period of time. And again, most of the folks that came in that we had to talk to turn around were appreciative and were understanding, even though they were definitely inconvenienced. But most of them were very, very good to us. Since we've done the temporary reopening, interim reopening, there are some that have the schedule a little off. Again, that schedule is posted on the message boards and has been posted on social media and on the county website. But generally speaking, the hours are being adhered to. It is not creating a massive line coming in or going out. Again, some of that I think has to do with the message being received, but also has to do with some of the improvements that were made at the scale house and being able to turn those transactions around more quickly than we were before.
Hey, Cliff, haven't the Baltimore County landfills, I believe 2 of them have opened over the past week. Not sure if the others reopen as we get to a point of normalcy. But I imagine that's also taken away some of the, over congestion that we were having. What do you think?
It's very possible. Now, when we were starting to check IDs or driver's licenses of the residents coming in, I think it was 2 or 3 a day, perhaps, that we were able to identify. So rather, I think it was more of a concern than a problem. But still, it's something that we do need to protect, as Commissioner brought up previously. It's our airspace, it's our facility, it's our asset. And we certainly do need to preserve it as much as we possibly can. But yeah, Baltimore County is back open to a degree. If I'm not mistaken, all of their customers need to wear a mask or a face covering. Frederick County, I've not been back in touch with. I know that they're entertaining, if they haven't already, reopening to a degree like we have. On a interim basis.
Well, Mr. Burdine, gardening is very helpful and therapeutic, so I hope you got your pepper plants started.
Yes, sir.
All right, anything else on the landfill? Cliff and Jeff and Eric and all involved, I especially want to thank you very much. And I'll just leave it at that. You all did a great job and got us back up and gave you a chance to catch your breath out there. And I think, again, we truly appreciate all your cooperation. So huge kudos coming from me. Thank you. Any other questions for our landfill? All right. Thank you, guys.
Thank you.
Thank you all. Thank you all again for your leadership. And thank you all for your leadership, and thank you to all the staff that helped. It was a team effort.
Okay. We are now going to go into briefing and discussion on something that our county administrator and staff have been working diligently on due to the fact that it's due May the 1st, which is, Friday, I believe. So I'm going to turn this over to Roberta. And I believe we will have most of our senior staff on here as well. And we'll go through this and entertain questions and discussion on this relief fund money. Roberta?
Well, thank you, and good morning again, commissioners. As you all know, the federal government has passed the Coronavirus Relief Act, and CARES Act. And part of that was money directed to states to help pay for some of the things that state and local governments are having to do in response to this pandemic. So $2.34 billion was allocated to the state of Maryland. And the 5 largest jurisdictions with populations in excess of $500,000 each are scheduled to receive direct distributions from the U.S. Treasury in about to the tune of about $691 million. The remaining funds will be received by the state of Maryland to be used on behalf of the state and the other 19 local jurisdictions. This state share of the remaining funds, let's see, is estimated to be about $364 million. So each county's share was divvied up based on our population, and the Carroll County's portion is a little over $29 million. So the state has decided to award half of that local share directly to the health departments, which is about 14.6 million, almost at 14.7. And then the other half will be go to each jurisdiction, to Carroll County, based on a plan that, as Commissioner Wance said, we have to submit by Friday. So county staff, along with all of our county partners, have been working diligently for the last week and a bit on putting together a plan, and the draft has been sent to you. As I said in my email last night, the plan is very high level, as intended. It's not expected to be detailed. It's also flexible. We're not guaranteeing that we're going to do all these projects or buy all this equipment. Once the funding's secured, the priorities will be set to determine what we do and when, and how the funding will be allocated along the various organizations. But this, as we found in the last 6 weeks, as we've struggled with this pandemic, and every day something new seems to come out. And so we have to be able to weave and jog, and therefore this needs to be as flexible as possible. And the state understands that. So we're planning on submitting a plan that is in excess of the 14.6 million for a couple reasons. It's intentional, gives us some room in case some of the things that we've submitted to the state are denied, which is possible. And also, if there happens to be any additional money from this project, from this pot of money, or from other money that might come down the pike, we're prepared and ready to take advantage of that. So next steps are for you guys to ask any questions you have about the plan. We will then, once you approve it, the draft, we'll finalize the documentation, add in final numbers in the next couple of days. Write a letter from our health officer, Ed Singer, because as the state, their intention at the moment is to send all 29 million to the health department, and the health department really does not want to manage all of it. They really don't want to manage any of it, and would prefer for us to get the 14.6, the county to get the 14.6. We just have a better opportunities to handle the money than the health department does. And then of course, a cover letter from the Board of County Commissioners. So before I turn it over to you, I just want to go over a couple things in the plan. You'll see there's an executive summary that's very high level on the plan. We did reach out to all 8 municipalities, the Sheriff's Office, the 14 volunteer fire companies, the State's Attorney's Office, the Circuit Court, the public libraries, Board of Elections, and Humane Society. So along with all of your 12 or 13 departments, we've reached out to them. We've separated the items that everyone mentioned into basically 5 categories, 4 of which are going to be submitted into this plan. The one category not submitted in the plan is personal protective equipment or devices. The reason that's not here is because those are medically related, and that's what the 14.6 million that the health department's receiving is to be used for. So we will submit those requests and those reimbursements to that half of the money. The other half of the money is divided into 4 categories: employee safety, continuity of operations, long-term resiliency, and constituent services. And the biggest there is, of course, an economic development plan for local businesses. Only other thing I would like to say is I truly thank everyone that has worked on this, both county government employees as well as those local partners I mentioned. This has truly been a collaborative effort. And I specifically want to highlight 3 people that really pulled this all together, and without whom this would not be a reality, especially in this time frame. We're barely into week 2 of the 2 weeks that we had to do this. Debbie Standiford, our just wonderful grants manager, Heidi Pepin, who was loaned to Debbie from the budget office to help pull this all together, and of course, Chris Weinbrenner, without whom we'd all look a lot worse. So without any further ado, I'll turn it over to you guys if you have any questions. Hopefully everyone's here. I was really hoping that Jack Lyburn would be on this. Unfortunately, I don't see him yet on the meeting, but if you have any questions about what he's calling Carroll Rebound, I will do my very best to answer them in his stead.
Roberta, I'll just share with you my initial thoughts. One, I appreciate the 3 documents you provided. It's very clear, and kudos to you and the team putting it together. I like that you went over to the total of, almost 20.5 million, because, my experiences in these type of funding is somebody's not going to either go all the way to the level they need to, or they may find that there could be funds still left over. So for us to have a priority list that goes well and above is a really smart, prudent measure to have in case there are funds additional that can be piled on top. So it's very clear to me, the direction, and I think it's most important that you're focused on the vision of each department on how to get through from an overall rebound from this pandemic. So just really very good job. That's all.
Okay, any questions on any of this? You all have had a day or 2 to digest most of the figures here. When Roberta and I first began to discuss this, my only avenue of direction was to try to hit high, because there are many things that we're not going to think about that are going to come up after the fact. And I think in some cases they have done this, and all of this includes, like for instance, the redesign of our lobby, which we've talked about. And, we've added the fire companies in there because all of us have seen the letters that we're getting in reference to the loss of revenue that our 14 are experiencing as a result of their fundraising events being either canceled or hopefully rescheduled. Let's put a hopefully on that one. But all of this comes into play here, and I think we're in a very good spot. And in some of the conference calls that I've been in with leaders across the state, and I continue to personally talk with many of them. I had a personal conversation with County Executive Alan McCarthy in Cecil County the day before yesterday about what's going on up there, and all of us continue to compare notes. But County Executive Barry Glassman came up with a good point on one of our conference calls that his health department would have trouble managing that amount of money. So that sort of is the onus behind the fact that we were asking to get that money for Ed, and Ed agrees that we would better manage it for him. So I've looked over this document several times. I know that there are going to be things that come up, but let's hope that we continue to see an additional amount of money that come in for all of these resources. But out of the gate, I got to give kudos to everyone for putting this together in such a rapid nature. And I truly appreciate that.
I appreciate Ms. Wyndham's leadership on putting together such a comprehensive proposal. It's very easy to read, easy to digest. So thank you very much for coordinating all those people. As I say, sometimes it's like herding cats, and you did a good job. Thank you.
Say thank you for putting this together in such a short time period. I think it was a great job. And I really appreciate the fact that I didn't accidentally delete it when it came into my email. So I actually got a chance to read it all beforehand. So that was fantastic.
Yes, thank you. This was very comprehensive, very well put together. Thank you all.
It's a new day in the Fraser household. He actually didn't delete something. Nicely done. Does anyone have any thoughts on anything that may be added to this, or suggestions on any of these itemized or these categories, if you will? Well, obviously, then you did do a good job, Roberta, because I'm not hearing anything. And again, I've been through all of it, and I don't really see anything. I was glad to see, and you and I had a conversation about this several days ago as well, about the fire companies, because it's very important to remember that could be a place maybe that could be a little bit challenging, but I think we need to be clear on this, that they are independent corporations and they have nothing to do with Carroll County government at this point. So I believe that is crucial in hoping that they get the funds that they need. So my only suggestion would be if an asterisk or whatever there could be put to ensure that they indeed understand that, because most of the counties across the state have some sort of fire protection, and it almost could be taken for granted that, well, that's not going to be part of that. We can't do that. So I think we need to clearly, and it doesn't have to be lengthy, but clearly say on there that these 14 independents are providing our fire and EMS for us. So hopefully we can get that money recouped. That would be my only suggestion on the report. Anything else for anybody?
No, I think, again, we're all saying the same thing. And with the addition of, making that modification into the draft, I'll move that the Board of Commissioners approve the draft plan and direct staff to submit it to the state and accept the resultant award.
Second.
And third, fourth, and fifth. Okay, yeah. And it's a work in progress, I know, and let's hope that we get some more funding as it comes down the pike. And I continue on my conference calls to try to stress that not only is it important to see reimbursement for our COVID-related expenses, but all of us truly across the state in every county need help with our operating funds as well. So let's hope that that becomes some sort of a mission here from our state as well, because that's clearly very important. All right, I've got a motion and a second on this. Anything else on this particular item? If not, all those in favor? And that is unanimous. Well done, staff. Roberta, well done. And to our directors, specifically to the three that you brought up, Chris and Debbie and Heidi, we can't thank them enough. They've done a great job. So thank you all very, very much. Anything else on that, Roberta?
No, thank you, except that I did take your direction and made sure that Commissioner Wance and made sure that everyone was very creative.
This is a think outside the box time, if ever there was one. So truly appreciate it. Thank you all. All right. I believe we are at the end of our agenda items. So I'll open it up for open admin. Anything for open admin, gentlemen or ladies? Lady.
Not for me, thank you.
I miss doing tours.
Motion to adjourn.
See what you did, Eric? That was quick.
Second.
Thank you. Thank you, Ed and Dick. We are back on the air at 9 a.m. on Thursday morning. As you heard in Priority Carol, all of us continue to be engaged in our respective communities, and we will continue to do that. For those that are still on, please make sure you continue to check our website. If you haven't signed up for Carol Connect, please do that, because you're going to get split-second information that's shared, that's going on in the county. So we can't say that enough. And we got to thank all of our partners as well that are still on the front lines. Everybody's doing a great job. So with that being said, we'll see you Thursday morning at 9 a.m. All those in favor of adjourning? Unanimous. Thank you very much. Everybody stay safe. See you Thursday. Thanks.